Hi, I'm Phil Durham. I'm a research assistant professor at University of North Carolina at Chapel Hill, and we study advanced uses of ultrasound for therapeutic applications. Diseases of the brain are really often pretty complex, and one of the main challenges of studying brain diseases is that there aren't great options for cell culture-based methods to really capture the complexity of the systems in the brain. A major challenge of developing treatments for the brain is getting the drugs to the brain. IV drugs typically encounter resistance at the blood-brain barrier, and part of our research seeks to overcome some of those barriers. So that leads you to in vivo work and diagnosing and following treatment for diseases of the brain at a preclinical setting can be challenging. That, along with diagnostic monitoring and response to treatment, those are all difficult things to assess, which better modalities, better instrumentation, better reagents would help us solve those problems. We've been working with Revity for a few years now. They have a great platform, of ultrasound platform that allows us to do volumetric imaging, which is really handy. We've worked with them to modify their system to actually enable it to do focused ultrasound treatments. And so using their platform, we're able to do volumetric ultrasound, image-guided focused ultrasound, which allows us to deliver these treatments to the brain specifically and in targeted regions pretty efficiently. And it doesn't take up much space on the bench. I've been doing focused ultrasound research now for about 8 years, and in that time, we've seen the first in human clinical trial of focused ultrasound for blood-brain barrier disruption, and it's really exciting. A lot of the clinical studies, the safety data is really good. It's been tested in a few different patient populations, and while focused ultrasound for blood-brain barrier disruption is not yet FDA approved, I'm really excited for the potential that it will be. And so I think when that happens, that'll open more possibilities for a variety of brain diseases. Great question. I want to first start off with saying I'm not a physician, so don't take any medical advice from me. But one of the things that I'm really excited for people to know about is what the potentials are for non-invasive treatment of brain disorders with ultrasound. There are a few FDA-approved indications for the treatment of Parkinson's, for example, and I think a lot of people aren't aware. So I'm here to spread the word about focused ultrasound and its use in therapeutic applications. So I want everybody to know about it.